Hi, Dr. Wade here, Doctor of Physical Therapy with Physical Therapy and Balance Centers, here to help you with your low back. We're going to teach you how to do a self-test, a very simple self-test on your low back in case you may have a problem such as sitting for a long period of time. Say if you can't sit for more than 10 minutes or so without pain in your back or down your leg, or standing and walking for a period of time. Like if you can't if you can't stand for say more than 10, 20, or 30 minutes without pain in your back or your leg, there could be a problem there with either your joints or your discs or the nerves or even the sacroiliac joint in your back. Let's find out. So we're going to teach you a simple range of motion test to see how your back does. So this is Saga, my trusted assistant, and we're going to take you through the 4 movements you need to be able to do easily and without pain. If you have a problem with these movements, then yes, you'll be able to report that to your physical therapist and they can help you with it, okay? So first move is called forward bending or flexion. We want to see you stand comfortable, hands in front, and you're going to lean forward without bending your knees. See how close you can get your fingertips to the ground. So as he leans forward, we see how close he can get his fingertips to the ground without bending his knees, and he comes back up. You should be able to do that without pain. Or normal would be within about 4 inches of the ground. If you have arthritis in your back loves to go all the way down. It likes that movement, okay? Disc problems, nerve problems, sacroiliac problems, they don't like that. Let's learn the next move you need to be able to do. Backward bending or extension. Hands on the hips without bending the knees. See how far you can lean backwards now. So he leans backwards and we see how far he can bend without pain. Typical pattern is pain across the low back. If you have that, that's not good. If you have pain that goes down your buttock or your leg, not good. You should be able to lean at least 20 degrees or more without a problem, okay? Even if you're 70 years old. Okay, so, or more. So turn away now. This is called side bending. You've learned forward and backward bending. Now we're going to test your ability to bend sideways. So hands down by your side, comfortable stance. Without leaning forward, we want to see how far you can lean sideways, as if you're reaching out down the side of your thigh. So he leans to the left. Good. And now we see how far he can lean to the right. And it should be equal both ways without pain. If you have pain or a restriction there, if it's unequal, it's a problem. Thank you, Saga. So now you know how to test your back. Be sure to ask questions below. Be sure to subscribe to our next video. If you did have a problem with that, be sure to call your local trusted physical therapist, get a consult, and see what can be done, because there's a lot of answers for the type of problem you have. I've enjoyed speaking with you today, and I'll see you in the next video.